What's up everybody, Dr. Ryan here, coming to you with a little bit of a different video than what I usually do. So today I want to react to dental scenes from one of my favorite shows of all time, Parks and Recreation. So let's see what happens. Let's get right into it.
So while they repaint the lines in the parking lot, we're asking everyone to do street parking.
I'm not street parking my Mercedes.
Well, everyone is. I'm doing it.
Because nobody wants to steal a Saturn.
All right, moving on
What's
to
wrong with the Saturn?
recycling.
You okay, Ron?
Just a little tooth pain.
That doesn't
I'm
sound
fine.
good.
Continue.
Okay,
needs a
each
dentist.
department will be getting blue bins. Do you need to go to the dentist, Ron?
I don't like dentists. Just a second.
Okay, so that is something that we hear probably a little bit more than we should. A patient coming to see us basically saying, I don't like you, or something to that effect. I don't like the dentist. I don't like going to the dentist. And unfortunately, that's a reality of the profession. And that is one of the unique challenges because most people who see you don't really like you or had a bad experience in the past. And that's part of growing in rapport with a patient. We have to break through that initial wall that a patient might have because they could come in having some trauma from the past with a bad experience, or maybe even just their parents had a bad experience and shared that with them, and now they think of dentists as the big bad villain from Finding Nemo. So that is something that we have to work on with a patient, build that rapport, build that trust, so that they are confident that you're doing the best that you can for them and that they trust you doing it.
Hey!
No.
No.
Never take your own tooth out, unless it's a baby tooth.
Oh my God! I'm sorry, everybody. What were we talking about? Recycling?
He's like
Dentist
not even
pulled the
bothered.
tooth out yesterday.
Okay, so that's definitely not obviously it's not a real tooth, but it's not even a fake tooth with the crown and the root portion. He's literally just holding what I would call a pontic, which is a fake tooth. So pontics can be part of bridges, which are fixed prostheses, or dentures, which are removable prostheses. And basically a pontic is a fake tooth. It's replacing a tooth that is currently not in the patient's mouth. So he's likely just holding the crown portion of a little pontic. And yeah, because there's definitely no root in that part.
But it's always a good idea to demonstrate to your coworkers that you are capable of withstanding a tremendous amount of pain.
It's not a bad idea.
Plus, it's always fun to see Tom faint.
That smile at the end, that's great. So fainting is interesting. Fainting, also known as syncope, is something that we sometimes deal with in the dental setting. Usually it's not after the fact, usually it's during or before treatment with an extraction particularly. And I think this has to do with the patient being fearful of what they're about to go through, or if a patient hasn't eaten something that day, they might have very low blood sugar, which puts them at much higher risk of experiencing syncope. So this is usually not something that we deal with after an extraction. Of course, I would be careful showing them an extracted tooth after it's out of their mouth. I would always ask a patient if they want to see an extracted tooth before showing it to them. Usually I hide it on the tray behind their head, and will only show it to them if they ask for it. And again, never extract your own tooth, guys, unless it's a baby tooth. I actually do routinely motivate and encourage pediatric patients to wiggle out their own baby teeth, especially if they're really close to coming out, because usually they're getting in the way, they're causing some soft tissue irritation, and wiggling those out will help clear a path for the permanent teeth to come in afterwards. For an adult though, never take out your own tooth. That's a bad idea.
Sorry, I'm late.
Andy, why don't you go with Ron and help him?
I really don't need...
Shotgun. I call shotgun. Where are we going? Doesn't matter. Shotgun. Shotgun on all rides for the rest of the day. For the rest of my life. In any car. Ha ha! I just faced
You gotta
sucker.
love
So
Andy
I'll see
Dwyer.
you in the parking lot, Ron. Later. Hey, Ron. Can I ask
Okay,
you
this
kind
is
of an important
definitely
question?
not a good idea. So if you're going to play on the playground, do it in a safe way, particularly not being upside down on monkey bars. Only being held up by your lower limbs, that is not a good idea. And actually, interesting note, playgrounds are the third most likely place that dental trauma happens. So number one is in the home. That's about think 20% of all dental trauma occurs at home. And then next would be schools, and then playgrounds is about 4 to 7% of all dental trauma.
You know,
So I
like
don't have a
when
good
you go to
feeling
the
about
ATM and you get money, is there an actual guy standing behind the wall who slides dollar bills in there?
No.
Yeah, there's robots. Oh, actually,
Ron
you know
is
what?
so
I do have a
patient,
serious
isn't he?
question. In the movie Predator,
What a great dad.
can you rub any kind of mud on yourself to prevent Predator from seeing you with his thermal heat signature sight, or is it more? Ow!
Okay, that actually looked pretty painful. I would be checking immediately for concussion and dental trauma, for sure.
That sucks. Are you hurt? Oh, no. All good. All good.
Oh, okay.
Oops.
Ouch.
Except for the mouth.
I also probably wouldn't be getting up from a fall like that so quickly. All of that blood, rushing to your extremities could lead to syncope. So not a great idea there either. I'd probably encourage Andy Dwyer to be sitting down and definitely look for that missing tooth that seems to have fallen out of his head, which is called avulsion. So avulsion is when a tooth is knocked out of your mouth and it's fallen on the ground or in your hand or whatever, but it's not in your mouth. All right, he found it.
Oh, whoa. 5-second rule. No.
So Andy's not entirely wrong. We do want to get an avulsed tooth re-implanted into its socket as soon as possible, but in ideally a sterile and controlled environment. So that tooth could very well be dirty, and I would not recommend just jamming that back into the socket. That could lead to infection. Also, it wasn't great how they were handling the tooth. It looks like they could have been putting their fingers onto the root portion of the tooth, and that is a big no-no. So you only want to handle an avulsed tooth by the crown. As soon as you start touching the root, you could be contaminating the periodontal ligament cells. Those are the cells that make up the periodontal ligament, which holds a tooth to the bone of the socket. Basically the ligament that's holding the tooth in place. And so if you contaminate those periodontal ligament cells and re-implant that tooth, the cells will likely atrophy and the tooth will become fused to the bone, which we call ankylosis. This is not a good situation because once a tooth is ankylosed, it literally can never move. So that means if the patient is continuing to grow, or let's say they undergo orthodontic treatment, that tooth will never move. So if a tooth becomes ankylosed, usually the best strategy is if it needs a root canal treatment, do the root canal treatment and then leave that tooth alone. Extraction of an ankylosed tooth is especially challenging. Also, about 60 to 80% of avulsed teeth do become ankylosed.
Come on, we better get you to a dentist. The receptionist says she'll fit you in as soon as there's an opening.
All right, so that's a good idea. Definitely go to the dentist as soon as possible. 30 to 60 minutes is the ideal time frame to get an avulsed tooth back in the mouth. If you are going to attempt it yourself, please make sure that you only touch the crown portion. Maybe gently rinse the root surface, not with tap water. Tap water has the incorrect salinity and can actually damage those periodontal ligament cells. I would rather you use milk, a saline solution, or kind of gross, but your own saliva. That can really help to save the tooth, slightly clean it off, and then re-implant it. Otherwise, take it to the dentist and store it in those media. So if this was a real situation, what I would hope that they do is put that tooth into a jar of milk or saline solution, or again, if it's the patient's own tooth, they could actually store it in their mouth under their tongue. So it's basically bathed in saliva so that you're trying to help nourish those periodontal ligament cells and keep them alive until the tooth is re-implanted.
If you're all right, I'm gonna head back to the park.
Hey, real quick.
Hopefully they would see him very
Do you know
quickly.
what my social security number is? Or if I'm allergic to anything, I don't like corn. Should I put that down? Or will that be confusing because I do like candy corn?
That's actually important because there's a pretty significant link between corn allergy and other food allergies, as well as a latex allergy. So definitely write down all of the things that you're allergic to, and a patient may have a latex allergy and we would use latex-free gloves.
Oh, Ron, what a mess.
Here, let me help you. All I wanted was 2
Such a good
hours
dad.
where I got to forget that I was a parent.
Look, I found all 3 differences.
Those are 2 completely different pictures.
Wow, that's very funny. I actually forgot about that part. Oh my gosh. And he seemed so proud of it too. Andy, gotta love him. So yeah, so that was my reactions to 2 dental scenes from Parks and Recreation. Let me know in the comments what you thought about this style of video. It's different than what I usually do. I had a lot of fun doing it. Maybe I can react to The Office, or I don't know. You guys let me know in the comments what you want me to react to next. Until next time, don't hang upside down by your feet only on the playground, and I'll see you in the next video.